With this, we move on to our third talk of the day. That's DGFG, a network for tissue medicine by Dr. Anna.
So I hope you can see my screen. Thank you for the opportunity to participate in that session. And it is an honor for me to present you today about our network for tissue medicine. And I would like to start with the situation in Germany, where we currently have tissues processed So currently tissues are processed by 3 national German multi-tissue facilities, and there's 22 bone banks with a distribution authorization. There's also about 130 local bone banks, and in Germany we have 28 cornea banks. 11 of them are within our DGFG network. And there's also 5 cardiovascular tissue establishments, out of which 2 are part of our network. In the scheme on the right-hand side, you can see that generally those tissue establishments can be either profit or non-profit, or they are organized in a public or in a private way. The legal situation in Germany is that following the Tissue Act that came into force in 2007, and that was the moment when tissue donation was separated from organ donation. And so the act is implemented by the Transplant Act, which regulates all the information rights and obligations, the consent for donation, and the tissue trade prohibition. On the other side, there is the Medicines Product Act, which regulates the tissue procurement and processing and the allocation of tissue. In Germany, we have an opt-in system. So the consent for donation is based on either the known will that has been declared during lifetime, or it is made by the presumed will when the relatives decide according to the deceased will. And of course, this can lead to a rejection of a tissue donation or a general or limited consent for tissue donation. And in Germany, we always separately have to ask if the tissue can be used for research purposes. So who are we? DGFG stands for German Society for Tissue Transplantation, and we are an independent and non-profit company that is based in Hanover. We were founded in 2007 when the Tissue Act came into force, and today we are owned by 4 public university hospitals and 1 Protestant hospital. We are not regulated by the state, we are solely independent, and our mission is the implementation of the tissue law to ensure a need-based, a safe and a transparent and cost-effective supply of tissue transplants for our patients. We also want to expand the non-profit work within the framework of a nationwide network. So the 5 shareholders of the DGFG, they own some shares, but the operational business is independent. And there's annual shareholder meetings, and there's no distribution of dividends to the shareholders. And if you look again at that scheme, so DGFG fits into the area of public and non-profit. Our network is spread all over Germany. You can see the headquarters with a little circle around in Hanover, but we are present in 30 different locations. And we have 50 coordinators that take care of the donation, and we work with more than 100 donation clinics. Our network contains 13 tissue banks, and for the cornea, we work with more than 120 transplant centers. We also have programs for cardiovascular tissue and for the provision of amniotic membrane. So what we do is the full process from getting the notification of a deceased person to coordinating the donation, to take care of the processing, and then to allocate the tissue throughout the country. The financing situation for tissue donation in Germany is that we ourselves only from the reimbursement rates from the distributed tissue. So all the expenses for donation, processing, storage, and allocation are covered by that reimbursement we get from the transplant centers. And they again receive the reimbursement through the health insurance company. And all activities that go beyond the core process of donation, which is research and development activities, communication and public relation, that needs to be financed through fundraising and sponsoring. So the benefits that we see working in a network is that our donation coordinators and the medical staff are employed by the DGFG. So we are locally present at many locations, and we have a shift system so we can work 24/7, and all the employees are qualified through regular trainings. And with this, the full donation process responsibility lies within the DGFG. And so the donation can happen independent from clinic resources. We have established reliable and compliant quality standards that enable an exchange between the tissue banks. And with this, we can optimally use the capacity of the tissue banks. We can also reduce our costs for the big tissue banks because we can centralized purchase the medium, for example. And with this, we can address challenges that you could have by having a surplus of tissue due to a low local demand on the one side, or to have a high local demand for tissue transplants that cannot be met. And so the DGFG network enables flexibility and planning security for the transplantation centers and tissue banks, but also we learned in the last 2 years that it creates a resilient structure in times of a pandemic, for example. What you see here is our distributed corneas from 2007 till last year, and we have increasing numbers throughout the time. And today, half of all corneas that are processed and distributed in Germany come from the DGFG network. So what we do to support the core processes, we have a centralized quality management, and we have public relation activities and also research and development activities. Speaking of those, we want to bring innovation to improve tissue transplants and to establish new scientific methods to finally transfer research into application. And we support research work. We do our own studies, but we mainly work in cooperation with national and international partners. And speaking about an international partnership, we currently have a cooperation project with the Dr. Shroff's Charity Eye Hospital in Delhi. And we receive funding for 2 years that will cover the travel costs, the equipment, and the training and education activities we're planning for the project. This is funded by the so-called hospital partnerships, which is under the umbrella of the Federal Ministry for Economic Cooperation and Development. The objective of the project is to increase the cornea donation numbers and enhancing the data management at Dr. Shroff's by establishing 2 new eye collection centers and by technically improving the data management of the eye bank and the cornea collection centers. And while we do this in our project, we are sharing a lot of knowledge about our processes and best practices in eye donation and banking. And this is really an exchange at eye level, where we learn that working in a multidisciplinary team and having diverse perspectives is a very positive thing when we speak about different conditions, regulations, and cultural aspects that can have an impact on cornea donation. This is definitely thinking outside of the box, and it makes us grow together in diversity. And with this, I would like to conclude my presentation, and I thank you for your attention.
Thank you, Dr. Anna, for a wonderful presentation, because here we see, I think we all should